vegans are, I think, the most deficient people on the planet.
I'm really good. I don't have any disease. Is there any need for consuming any particular, supplements or?
So, I mean, if you're an apparently healthy person and you are taking an omnivore diet, for example, you have balanced plant, animal, and dairy products, it may not be actually exactly what you require, because it also depends on a level of activity. So, for example, somebody who's very active would require higher amounts of proteins and carbs, in a daily basis. But if you are somebody who's following a typical diet, for example, vegetarians who do not consume any animal protein, fish, eggs, chicken, they don't consume any of that. You can have chances of getting vitamin B12 deficiency or folic acid deficiency, and supplementing those patients, identifying those patients at risk for deficiencies and clinical complications due to deficiencies, supplementing them that particular vitamin or the mineral or micronutrient. It is rational, it is reasonable. Veganism. Vegans are, I think, the most deficient people on the planet, because they don't they don't take anything other than plants. So purely plant-based diet. You need to supplement calcium. You need to supplement vitamin D, folic acid, vitamin B12, omega-3. You name it. So being a vegan is probably morally, ethically good, but science-wise, I think they are the most undernourished people without supplementation.
But ethically also, it's not right to actually give a
But
vegan
but
diet to dogs and cats and children, right?
but
I don't
instead of
think anybody deserves a vegan diet. And from a recommendation point of view, I don't think anybody. I mean, there are these people who have their brains wired with respect to ethics and morality, saving the planet and saving the universe and the Milky Way, things like that. I mean, for them, I think veganism makes sense, but I don't think it makes sense for people who want to lead normal lives.
because many vegans are claiming like their diet is it's very good for pregnant ladies and children. So what do you think?
So I'm not sure if this practice is very much common in, at least in Kerala. I mean, this veganism in, in vulnerable population, we call them. Vulnerable population is pregnant women, lactating women, children, elderly. I'm not sure if this is actually practiced much in our part of the country. But putting a child on a restrictive diet just because you think there is some ethical or moral aspect to it rather than the science and nutrition, I think it is criminal. But once they grow up and they become adults and they actually want to do this from their own personal choice, I mean, it's fine. But I don't think we have to ethically or morally recommend a scientifically inferior diet to vulnerable population, because it only causes more trouble, and we don't want to invite trouble, especially when it comes to health in children and pregnant women and lactating women and such vulnerable population.